Protect your cognitive vitality by learning how to avoid risks. Did you know that about 1 in 3 adults worldwide has high blood pressure? And about half of them don't even know they have it. In the United States, nearly half of all adults have high blood pressure. But only 1 in 4 has it under control. High blood pressure, also called hypertension, usually doesn't cause any symptoms, but over time, it can quietly damage your body. It increases the risk of heart attacks, strokes, and even death, as about 13% of deaths worldwide are linked to high blood pressure. But hypertension doesn't just affect your heart. It can also harm your brain. When blood pressure is high, blood pushes aggressively against artery walls, forcing the heart to work harder and damaging the tiny blood vessels that keep your brain healthy. Over time, this damage can lead to cognitive decline. That is why the Lancet Commission lists high blood pressure during midlife as one of the top things you can change to lower your risk for dementia. And it is not just a problem for older adults. Research shows poor cardiovascular health can start harming brain blood vessels even in your 20s and 30s. So, what exactly counts as high blood pressure? According to current guidelines, hypertension is defined as having a blood pressure measure greater than 130/80. The top number, called systolic blood pressure, is the force on your artery walls when your heart beats, while the bottom number, called diastolic blood pressure, is the force when your heart rests between beats. The SPRINT study found that even 130 might be too high for systolic blood pressure. People who lowered their systolic blood pressure to below 120 greatly reduced their risk of having cardiovascular disease events, such as heart attacks. The additional blood pressure lowering also provided better protection against cognitive decline. Based on this study, people with systolic blood pressure between 120 and 129 are considered to have elevated blood pressure. What can you do? First, get your blood pressure checked regularly, especially if you haven't had it measured recently. Many people have high blood pressure without knowing it. Eating a healthy diet full of fruits, vegetables, and whole grains, and cutting back on salt and sugar can help. Regular aerobic exercise also makes a big difference. If lifestyle changes aren't enough, doctors can prescribe medicines called antihypertensives to lower blood pressure. There are many kinds, including diuretics, beta blockers, calcium channel blockers, ACE inhibitors, and ARBs. Some people respond better to some classes of antihypertensives than others, depending on their physiology and sensitivity to certain types of side effects. Since research indicates that there is no single best antihypertensive for brain health, the best one is the one that most effectively lowers your blood pressure with minimal side effects. Uncontrolled high blood pressure is serious but treatable. The earlier you act, the better you can protect your heart and your brain. To learn more about protecting your brain at every age, visit cognitivevitality.org.